In healthcare, there is a fine line between respecting how people identify and recognize themselves and the reality of genetics. Here's the question we are facing today. As nurses, how do we balance honoring gender identity while knowing that biologically there are only two sexes?
Can we do that, though, ethically speaking?
It is not about erasing anyone's experience. It's about providing the best possible care based on the realities of human biology. Let's dive straight in. We live in a time where the gender identity has become a deeply personal and important part of who people are. More and more individuals identify outside of the traditionally binary of male and female, and it's vital that we as healthcare providers show respect and understanding towards those identities. In fact, it's our duty to treat each patient with the dignity and provide compassionate care, no matter how they identify. But here's where the challenge comes in. While we can and should respect gender identity, the fact remains that genetics, the DNA we are born with, tells a different story. From a biological perspective, there are two sexes, male and female. These two sexes are determined by the presence of either XY or XX chromosomes. And these chromosomes don't just dictate external physical traits, they have a profound impact on how your body functions, how it responds to diseases, and how it reacts to treatments. So how do we as nurses navigate this space? How do we reconcile respecting gender identity with the fact that biological sex plays a crucial role in healthcare? Let's start with the basics. When we ask about a patient's sex, it's not to dismiss or undermine their gender identity. It is because biological sex directly influences how we diagnose and treat certain conditions. Take heart disease, for example. Women and men often experience heart attacks differently. The classic chest pain symptoms we hear about is more common in men, while women may have more subtle symptoms like nausea, shortness of breath, or back pain. If we ignore biological differences between the sexes, we might miss critical signs and delay life-saving treatment. Or consider medication. The way drugs are metabolized in the body often depends on whether someone is biologically male or female. For instance, research shows that women metabolize certain medication like sleep pills more slowly than men, which means they could experience more potent side effects. If we don't take biological sex into account, we could end up prescribing the wrong doses or giving advice that doesn't align with how the patient's body actually processes the drugs we give them. But here's where things get a bit tricky. Gender identity and biological sex don't always align. Someone may identify as male but was born with being biological female or vice versa. That is where our role as nurses becomes even more important. It is our job to respect their identity while still ensuring their medical care is tailored to their biological needs. One of the key ways we can do this is through open and respectful communication. It's not about forcing a patient to conform to a binary gender identity. They've chosen how they identify, and that matters deeply. But it's about asking the right question and explaining why certain aspects of their biological sex might influence their healthcare. For example, we might need to explain to a transgender man that even though he identifies as male, if he hasn't undergone the full hysterectomy, he's still at risk for conditions like ovarian cancer or other conditions aligned with the female gender. For a transgender woman, we might need to discuss the ongoing need for prostate exam if she hasn't had surgery to remove the prostate. This can be an uncomfortable conversation for both the patient and the nurse, but it is essential. The key is to approach it with empathy and clarity. We are not denying who they are. We are simply acknowledging that when it comes to medical care, some treatments and screenings depends on biological sex, and we have to make sure they understand that this is about their health, not their identity. Another challenge we face is understanding hormone replacement therapy for transgender patients. Hormone replacement therapy is a critical part of aligning someone's physical appearance with their gender identity, but it's also introduce complexities that needs careful management. For instance, estrogen and testosterone have significant side effects on the body that differs depending on whether someone is biologically male or female. For a transgender woman taking estrogen, we need to monitor for increased risk of blood clots or changes in cardiovascular health. For transgender men taking testosterone, there's an increased risk of certain types of cholesterol changes or liver issues. And again, I want to underline, this isn't about invalidating someone's gender. It's about ensuring their body responds safely to the treatment. Hormones interact with the body based on genetic sex, and we need to manage those interactions with precision and care. So now let's talk about genetic diseases. There are certain conditions that are linked to gender, meaning they are directly related to whether a person has an XX or an XY chromosome pair. Hemophilia, for instance, is far more common in biological males because it is linked to the X chromosome. Color blindness and some muscular dystrophies are also examples of conditions that are more likely to affect one biological sex over the other. If we ignore biological sex when assessing a patient, we might miss these risks or fail to screen appropriately for certain conditions. But how do we do this while still showing respect for the person in front of us? It comes down to separating identity from genetics in a way that honors both. We can acknowledge that someone identifies as male or female or non-binary or whatever we have of sexes nowadays, while explaining that their genetics influence certain aspects of their health. It's a delicate balance, but it's one that allows us to provide the highest level of care without compromising our respect for the identity of the patient. Because the reality is, healthcare requires us to walk this line, if not every day, then close to. While gender is a social and personal construct that has evolved over time, biology remains a constant. Chromosomes don't change based on how we identify, and neither do physiological processes. But this doesn't mean we can't be sensitive to the emotional and physical aspects of gender identity. In fact, it is crucial that we are sensitive to how someone identifies. One of the most important things we can do is foster an environment where patients feel seen and respected for who they are. That means using the right pronouns, addressing them by their chosen name, and by recognizing that their identity is an integral part of their well-being. But at the same time, it means being honest. Not just about, oh, you are having this disease, but about the role genetics plays in their health. This isn't about choosing one over the other. It's about integrating both to provide compassionate care. And if you want to get smarter on how you can do that, I will warmly recommend that you use Mikhail Bakhtin's theory is linked at the end of this episode, so make sure you watch all the way to the end and click that link and you will get to an entire playlist with his theory. But let's get into an example. If a transgender patient comes in for a routine checkup, we might start by asking about their overall health, how they are feeling in terms of their gender identity. This shows that we listen and that we care about their experiences. Then we might explain why we need to know about their biological sex. And this is because certain screenings, treatments, or medications depends on it. And by approaching it this way, we make it clear that both aspects are important and that we are not prioritizing one over the other. Ultimately, what we are doing as nurses is providing personalized care. We are not treating people based on generalized assumptions or one-size-fits-all guidelines. We are looking at each individual, understanding both their identity and their biology. And with that, we can tailor our care accordingly. And this is the heart of healthcare, treating people as whole human beings with respect for who they are and the biology factor that impact their health. And this is not only, well, when it comes to transgender, it is when it comes to everything healthcare. But when it comes to respecting gender identity in healthcare, it's about the balance. We can honor how a person identifies while also recognizing their genetics. And as I promised you, with the Michael Bakhtin's theory will help you do that. And this entire playlist that will take you deep into this theory. So I warmly recommend that you check this one out.